Obs and Gynae. I am Dr. Raina Chawla, and this week we're going to be discussing one of the guidelines. So this is the session on GROW Guideline Review of the Week, and what we're going to be discussing is air travel in pregnancy. Now this is a very important question, especially when you come into practice. You have a lot of patients asking you, doctor, is it safe to travel? Like, can I fly? Can I go here? She may be in her first trimester, second trimester, third trimester. Do I need a fit to fly certificate? So there are a lot of queries from the patient side, and also from the exam point of view, you may get a short note on air travel in pregnancy because it's become a very common means of transportation, and you should know the guidelines and the science behind it. So what are the two referring papers that I have? One is from the RCOG, that is the scientific impact paper, and this is scientific impact paper number 1, after which further updates, no recent updates have been there. And the ACOG is very recent. This is ACOG number 746, and this is very recent, 2023. It was reaffirmed. So two important papers which covers this topic, the RCOG and the ACOG. Now if we go to the RCOG, we'll discuss what's given here first. What this paper says is that the concerns that are there in pregnancy. So let's understand a bit about the physiology, and then we go into what are we supposed to do or what are we supposed to tell the patient. Now one of the concerns is altitude. Now altitude is, so what happens as we go higher and higher up? Okay, the air thins out. That means what? That means the pressure reduces. The air pressure reduces, and normal cruising altitudes are 4,000 to 8,000 feet is a normal cruising altitude at what level we fly. As we go up, the air thins out, so the air pressure reduces. But that doesn't matter too much because the cabins are pressurized. So all the aircraft you travel in, they are pressurized cabins, so you don't feel that thinning of air, you don't feel that hypoxia, okay, to a significant extent. Although there is lesser oxygen even in a pressurized cabin, the oxygen saturation will drop by around 10%, and that is not very significant to affect a normal pregnant healthy adult person, even if she is pregnant. Okay, in fact in pregnancy the physiology is such that fetal hemoglobin has more attraction towards oxygen, so it doesn't matter too much in pregnancy, this drop of 10%. But that's an important thing that happens, which is worrisome. And the other thing which happens is there is reduced humidity. That means the air is very dry. If those who traveled in aeroplane, you would know that the air is very thinned out, it's very dry, you feel more thirsty. So that's important. Dehydration can happen, and it's important to keep the woman hydrated. Another thing that can happen is gases expand. So intra-abdominal or gases inside the ear, inside the nose. So nasal congestion will worsen, ear pressure will increase, gaseous intra-abdominal pressure will increase, and that is important because if the woman has sinusitis, or if the woman has an ear infection, that may get worse. Or if the woman has, or any person who's recently undergone a GI surgery where there are stitches on the intestine, okay, say an anastomosis or something like that has happened, then those stitches can give way because of the bowel gases which tend to expand as the altitude increases. So this is what we are worried about in a woman, especially in a woman who's pregnant. Also a very major concern is the risk of DVT. As we all know, pregnancy is itself a hypercoagulable state. So she's anyway at risk of thromboembolism. Add to it prolonged immobilization, especially in medium to long haul flights. What do you mean by medium to long haul flights? So a short haul flight is one which is less than 3 hours. A medium haul flight is 3 to 6 hours. A long haul flight is more than 6 hours. So any time she's traveling for more than 3 hours at a stretch by flight, and this usually would apply to international air travel, there is an increased risk of, there's a theoretical increased risk of deep vein thrombosis, and we have to advise the patient what precautions to take if she's going on a medium to long haul flight. So this is one risk there. And of course, if she has added risk factors, say she has a higher BMI, say she has a past history say she is known case of APLA, then most of the times these patients would already be on heparin, low molecular weight heparin, but if not, we have to optimize her and see the risk and see whether she requires heparin or not. Okay. Another worry, okay, and this is a worry which many patients do come to us with, is cosmic radiation. So as you go further and further up, there is increased cosmic radiation. So will that be harmful to the pregnant woman? Everybody Googles these days, so they get worried about this. Now, what does the guidelines say about this? It says that the International Commission on Radiological Protection recommends a maximum annual radiation exposure limit of 1 millisievert. That's the unit for members of the general public, and for a pregnant woman, 1 millisievert over the course of a 40-week pregnancy. That's the maximum limit. Now remember, even in the longest intercontinental flight, and I did some research on this, the longest intercontinental flight is a 19-hour flight from New York to Singapore. Is the longest intercontinental flight, and that flight you get less than 15% of 1 millisievert. So the longest 19-hour flight also has only 15% of the maximum limit of radiation that the pregnant woman should have in her 40-week course of pregnancy. So it's not significant, in simple words. Another even more common doubt is that the scanning machines in the airports, are they safe? They're so worried about these. These are called as backscatter machines. Okay, and remember, tell them, when a patient asks you this, tell them that the radiation exposure in those scanning machines is less than 10,000 times the radiation they get from their mobile phone. Okay, so in other words, it is completely safe. A mobile phone will have 10,000 times more radiation. So that's more dangerous. If they're worried about the body scanner, tell them they should be more worried about their phones. Okay, so body scanners are safe. Another important thing is the airline is concerned. The airline is not happy if a pregnant woman is traveling with them because of safety concerns. She may go into labor, she may have some complication. The flight may have to get diverted, all for that one medical reason. So they are pretty strict about taking a pregnant woman on the flight with them. Okay, and hence they usually ask for a fit to fly certificate after 28 weeks of pregnancy, and this is usually valid for a week. Okay, so every time she has to fly after 28 weeks for a week, that certificate is valid. Okay, and most flights will not advise flying after 36 weeks. It is contraindicated. They will not allow a pregnant woman to fly after 36 weeks. This is for a low risk patient, low risk singleton. For multiple pregnancies, this cutoff is 32 weeks. This is for a multiple pregnancy. That means a twin or a triplet pregnancy, they will not allow her to fly after 32 weeks. So 36 weeks is the upper limit for singleton, and this is of course varies from airline to airline, but most airlines will have 36 weeks as the upper limit for singleton, low risk, and high risk or multiple pregnancy, it is 32 weeks as the upper limit. But again, the patient should refer to the airline brochure and the airline website to see what specific requirements they have. Okay, this is just in general. Now, what are the contraindications? These women should not be flying at all. Women who have severe anemia, women, and the RCOG has defined this as less than 7.5 grams. Women with a recent history of hemorrhage, maybe she's had placenta previa auto bleeding, or maybe she has had threatened abortion in the first trimester, don't let her travel. If she has, I told you this, nasal congestion or ear infection, it can expand and worsen her condition. Serious cardiac or respiratory disease, do not let her travel. There is a theoretical risk of hypoxia, of less oxygen saturation, also increased risk of DVT, don't let her travel. Those who have sickle cell anemia, so recent sickling crisis, don't let them travel. I told you this recent GI or laparoscopic surgery where there have been GI procedures carried out, and when sutures or lines on the intestine could come under stress due to reduction in pressure and gaseous expansion. History of recent fracture again increases the risk of DVT. So a history of recent fracture where significant leg swelling can occur in flight, again expansion, is particularly hazardous in the first few days of a cast being placed. Do not let her travel. Okay, so I'll just quickly go through them again. Severe anemia, recent hemorrhage in any trimester, nasal congestion, sinusitis, otitis media, serious cardiac or respiratory disease, known case of heart or respiratory disease, recent sickling crisis if she's sickle cell anemia, recent GI procedures with sutural lines on the intestine, and recent fracture, do not let them travel by air. Do not give that fit to fly certificate. Okay. Now, a few more advice the scientific impact paper mentions is, in the first trimester, of course, confirm the location. Where is she going? How much is the distance of the flight? Or not only in the first trimester, she do this in every trimester. Is she going to an area, and the main reason why they mention this is she going to an area endemic to malaria or endemic to say yellow fever? Is her vaccination complete? Is she at risk? Is her pregnancy at risk because that area is endemic for certain type of disease? That's very important. Also the duration of the flight. Okay. Avoid after 36 weeks in singleton pregnancy and 32 weeks in a multiple pregnancy. And then there are certain things she should do to minimize the risk of DVT, especially in a medium to long haul flight, that is anything more than 3 hours. And how should she minimize the risk of DVT? Preferably take an aisle seat. An aisle seat means not a window seat, not a middle wala seat, a seat next to the aisle means the central passageway. Okay, so it's easier for her to get up and walk around. Okay, so take an aisle seat. Regular walks around the cabin, okay, should be advised. Or in seat exercises, every 30 minutes stretch her legs, move her arms, okay, do a bit of exercises while she's on the seat. Maintain a good fluid intake, avoid dehydration. The air gets dry, she can have dehydration, keep drinking fluids. And then each patient should have an individualized risk assessment for thrombosis, because if she's at higher risk, she may need to be started on low molecular weight heparin. Okay, now just a second, I'll go back here. Now, although it says aisle seat and regular walks around the cabin, the certain other guidelines and certain other places I read for, and the Americans also say that the seat belt should be on at all times. So that means she should not be regular walking around the cabin. The exercises on the seat are enough, because what happens, another thing we're worried about in a pregnant woman is when there is turbulence in flight. If there's turbulence in the air and things fall from the top, and the woman can get flung, or people can get flung from their chairs here and there. So it's better that she keeps her seatbelt on at all times to avoid trauma during turbulence. Now, how can you prevent DVT? What do the guidelines say? What does the RCOG says? It says for short haul journeys less than 3 hours, no specific measures. It doesn't mention much. It doesn't mention anything, in fact. For medium to long haul flights, however, that is more than 3-hour flight, properly fitted graduated elastic compression stockings should be advised to her. Okay, and also to keep herself well hydrated, to do those in-flight exercises. And if she's at high risk for thrombosis, which otherwise also we would have started her on pregnancy, start her on low molecular weight heparin. Okay. Now that was the RCOG. So it's very simple, very straightforward. Quick revision is that you are worried about reduced reduction in oxygen, you're worried about low humidity, you're worried about gaseous expansion, you're worried about increased risk of DVT. So what should you do if she's on for DVT, especially if she's on a more than 3-hour flight? Advise her exercises, give her an aisle seat. So if she wants to walk around, although the Americans say keep the seatbelt on at all times, preferably keep the seatbelt on all times, should be advised to her. Apart from that, she should be hydrated. She should be given graduated elastic compression stockings. She should be keep drinking lots of water. When will you not allow her to fly? If she has anemia, if she has nasal congestion or otitis media, if she's recently had a fracture, if she has cardiac or respiratory compromise, okay, then you will not allow to fly. 32 weeks is the upper limit for singleton and for multiple pregnancy, and 36 weeks is the upper limit for singleton pregnancy. So 32 weeks multiple, 36 weeks singleton. So this is in brief about the RCOG scientific impact paper. What do the Americans say? And the Americans say that occasional air travel during pregnancy is generally safe. So similar things. Recent studies suggest no increase in adverse pregnancy outcomes for occasional air travel. Air travel is not recommended at any time during pregnancy for women who have medical or obstetric conditions that may be exacerbated by flight or that could require emergency care. Remember, we had read recent hemorrhage also. I missed that out. Recent hemorrhage also should not allow to fly. in craft environmental conditions like changes in cabin pressure and low humidity coupled with the physiological changes of pregnancy do result in adaptations including increased heart rate and blood pressure and a significant decrease in aerobic capacity. And how can we minimize the risks in pregnancy? Give her support stockings, periodic movement of the lower extremities, avoidance of restrictive clothing because that could add to her dehydration. Let her have loose fitting clothing except for the compression stockings, occasional ambulation and maintenance of adequate hydration should be maintained along with keeping the seatbelt on at most times except when she is occasionally ambulating. So this is what, there's a bit of a difference here. It says, the same guideline says occasional ambulation should be given, and then it says instruct to use the seatbelts continuously while seated. The seatbelt should be belted low on the hip bones between the protuberant abdomen and the pelvis. So when she's seated, that time at all times she should have the seatbelt on. Gas producing foods, so avoid gassy drinks, like sodas and all. Avoid gas producing foods or drinks before scheduled flights because entrapped gases will expand at altitudes. Also remember, they are at a higher risk of motion sickness, they are higher risk of vomiting. So preventive antiemetics should be given in those women who have a predisposition to developing nausea. Pregnant women can fly safely, observing the same precautions for travel as the general population, and they should specifically check, they should check with their specific air carriers for the airline requirements. But as I said, most airline requirements will allow till 36 weeks for singleton and 32 weeks for multiple pregnancy, and after 28 weeks a fit to fly certificate has to be issued. So why, just a small a few lines about why these guidelines are important. Many of you ask me, ma'am, do we need to learn this or that? And what I found is this beautiful quote, and I do truly believe in evidence-based medicine because ignoring evidence leads to avoidable harm, okay, and failing to admit our uncertainties means we don't get better evidence. So evidence-based medicine is the norm now, okay. And if you're following evidence-based medicine, you are also medico-legally safe. Okay, so you can say you can prove yourself in the courts that this is what evidence says and this is what I was following. So this protects you medico-legally also. It keeps you updated with recent information and it helps you grow in your career. Thank you very much.